Hello, this is a quick introduction to the new Maternity Early Warning Score we're going to be introducing into ESNEFT on the 20th of May 2024. MEWS is to be used when a patient is pregnant at any gestation, when a patient has been pregnant in the past 4 weeks, including a miscarriage, termination or postpartum, and it's really important that these pregnant patients have their observations taken on a paper news chart and not on Sentinel, as Sentinel does not account for the physiology of pregnancy. If you're caring for a patient outside of obstetrics, if they are above 16 weeks pregnant in Colchester or above 20 weeks pregnant in Ipswich, you must let the midwife in charge know that you are caring for your pregnant patient. They will then come down and review the patient if necessary. If your patient is underneath these gestations and there are issues to do with their pregnancy, please contact gynae. If you are a medical doctor looking after these patients, please refer to the obstetric registrars. So, maternal red flags. There are certain red flags within pregnancy that you need to be aware of. So where a patient is above 16 weeks and up to 4 weeks postpartum, if any of the following flags are present, then contact maternity triage immediately. If your patient has hypertension, including a blood pressure over 140 over 90, especially if they have a headache, new onset edema, right upper quadrant pain, visual disturbances, significant proteinuria, thrombocytopenia, or a deranged liver or renal function, reduced fetal movements, vaginal bleeding in pregnancy, a cord prolapse, seizure without known epilepsy, abdo pain, or any signs of labour. This is what the new Maternity Early Warning Score looks like. Patient's observations score either a 0, a 1 or a 2, depending on how abnormal that observation is for a pregnant patient. You'll be looking at their respirations, their saturation rates, their temperature, their pulse, and their systolic and diastolic blood pressure. The use of oxygen and change in GCS or AVPU comes in later in additional concerns. Please note that there are 2 different pulse ranges depending on the gestation of pregnancy. So if your patient is pregnant, you take their pulse on the blue line. This allows a tachycardia up to 112, which has been shown to be normal in late stages of pregnancy. If you are caring for a patient within early pregnancy or whose pulse baseline has been much less than this, use your clinical judgment. You do not need to wait until it starts to score. If you feel that the pulse is too high for your patient, please escalate. Where a patient is over 48 hours postpartum, including 48 hours post miscarriage or termination, you take their pulse on the purple line. You only ever need to plot a pulse on the blue or the purple line, never both. Once you have added up your overall MEWS score, you need to tick, are there any additional concerns? So as the healthcare professional, are you concerned about this patient? We know that these patients often compensate, and therefore you might notice that something's changed before their physiology changes. Likewise, is the woman or the family concerned? Is your patient receiving any additional therapies such as oxygen? Do they have an increased pain, significant vaginal bleeding, a reduced urine output, or a decreased GCS? NHS England have given us a set escalation criteria. If your patient is scoring between a 0 and a 1, you continue with the current observation frequency. We recommend that when you're looking after a pregnant patient, they have their observations taken at least every 4 hours, and within the emergency department hourly. If your patient is scoring between a 2 and a 4, if you are within an obstetric area, you need a review by the midwife in charge. If you are in a non-obstetric area, please inform the nurse coordinating that shift. If you then feel that you need the midwife to come and see the patient, you can escalate to them. You also need a review by an ST1 or 2 within 30 minutes. You're going to reassess the observations within 30 minutes, and the ST1 or 2 needs to document an ongoing plan. At this point, if you feel the patient's observations are normal, for example, the patient always runs hypotensive, it's fine for that doctor to document an ongoing plan to drop the observations back down to every 4 hours. If your patient is scoring between a 5 and a 7, you need an urgent review by a midwife in charge if in obstetrics, or by your nurse in charge if on a ward. You also need the registrar caring for that patient, so either an obstetric registrar if you're in obstetrics, or the team caring for your patient if you're on a general adult ward. They need to review within 15 minutes. You're going to reassess within 15 minutes and document an ongoing plan. If your registrar is unable to attend within those 15 minutes, please escalate to a consultant or equivalent. If your patient is scoring 8 or more and you're in an obstetric area, you're going to get your midwife in charge there immediately. If you are within a nursing area, you let your nurse in charge know. That patient then needs an immediate review by a registrar or above and consider review by the critical care outreach team. Continuous observations are then required. A score of 8 or more within a pregnant patient can be life-threatening, and please take this seriously. Where a patient is scoring a 5 or more, you're going to complete a sepsis screen. There is a specific pregnancy sepsis screen available, and if you don't have one within your area, you can get one from either the emergency department, gynae, or obstetrics. If your patient is scoring an 8 or more, that's an automatic red flag sepsis. If your patient has any additional concerns, you're going to escalate higher than the original MEWS score. For example, if your patient is scoring a 0 to a 1, but they have any additional concerns, such as a healthcare professional concern or receiving oxygen, they go up to a low-medium escalation category and get a review within half an hour. You then reassess the observations within 30 minutes. Likewise, if your patient is scoring between a 2 and a 4 and they have any additional concerns, you go up to a medium and then from a medium to a high category. The idea here is to catch early signs of deterioration before the patient's physiology changes. So in summary, we will be launching the new maternity early warning score on the 20th of May 2024 from morning handover. If your patient is discharged from ED and they're over 16 weeks pregnant in Colchester or over 20 weeks pregnant in Ipswich, please make sure you inform the senior midwife so an appropriate follow-up can be arranged. If your patient is admitted to the ward, HDU or CCU, then the admitting doctor is to inform the obstetric registrar. In summary, MEWS is to be used in all gestations of pregnancy and up to 4 weeks postpartum. MEWS will need charting on a paper chart and not on Sentinel. Additional concerns increase both the monitoring frequency and the level of concern. 48 hours post-birth, the heart rate parameters change to account for the change in physiology. If you have any questions, please contact Camilla Ely Scott at esneft.nhs.uk. Thank you.